Thank you. What a day for single payer, huh? To see all these people out here today, to see the nurses that we have in the room, to see the doctors that we have out, to see the patients, to see all the people committed to their patients, to society, to each other is something that always has when I worked at PNHP and continues to touch my heart. So thank you, all of you. So my name is Nick Skala. I am the co-founder and secretary of Healthcare for All Illinois, which is a statewide coalition of nurse and labor and healthcare advocacy and consumer and women's and political and other kinds of social groups advocating for single payer in Illinois and for our nation. Healthcare for All Illinois is comprised of dozens of groups representing thousands of Illinoisans and hundreds of Illinois physicians. On their behalf, I'm here today to express our support for the Kucinich Amendment to H.R. 3200, which, as our other speakers have acknowledged and pointed out, would remove one of the primary barriers faced by states wishing to implement single payer. This is what Congressman Kucinich talked about, ERISA federal preemptive challenges, which, if you don't think they're real, already have torpedoed incremental reform in Maryland. Maybe Margaret can mention that, and threaten to obstruct comprehensive health care single payer reform. The Kucinich Amendment would effectively eliminate this threat by clarifying the ambiguous federal law so as to state unquestionably that ERISA does not preempt the establishment of state single-payer plans. Now, as for Illinois, in 2006, State Representative Mary Flowers, who, by the way, is chairman of the Health Committee in the Illinois House of Representatives, introduced the Healthcare for All Illinois Act, House Bill 311, into the General Assembly. This was the first time that a single-payer bill had ever been put in front of our legislature. And the liberal establishment, to be very forthright and frank, sort of shrugged and rolled its eyes at us when we did it. We were told, we, the advocates of single payer, that it wasn't politically feasible, that we'd never have support for our plan, the legislature would never go for it. And today, House Bill 311 has more co-sponsors than any other health care reform plan currently before either body of the Illinois legislature. It includes the Speaker of the House and the House Majority Leader. We were told when we introduced it that it wasn't worth it because the bill would be relegated to some obscure committee like Rules. It would never see the light of day. And this year, our single-payer bill for the first time was reported favorably out of committee by an 8-4 majority and recommended due pass to the House of Representatives. And we were told, like we're told in this healthcare reform debate, that people like the insurance that they have and they don't want single-payer. HCII now has one of the largest activist bases of any progressive group in the state. And at our last lobby day in April, we had so many hundreds of activists descending on Springfield on a Tuesday afternoon that the Capitol staff had to move us from the smallest hearing room where we were relegated to the largest one. And every legislator on the committee who came in to take a look at it, I saw do a double take. The room was 2-3 times as full as this one is right now. The reason that we need the Kucinich Amendment is that we are going to pass a single-payer bill in Illinois, in Pennsylvania, in California. And it would be a disservice to the staff members that are here today if we failed to acknowledge the transformative leadership that accounts for these accomplishments. I can say without equivocation that the single-payer movement in Illinois would not be where it was today were it not for the leadership and the support and the courage of the California Nurses Association and the National Nurses Organizing Committee. I know this because, as Donna mentioned, I wrote the legislation. I wrote the single-payer bill, and that's in front of the legislature right now. And I approached what let's call the more established sectors of organized labor, and I heard the same thing everywhere that I went, which was, we're with you, Nick. Really, really, we're with you. It's just not politically feasible right now, so we're not going to do anything. We're with you. We're with you. We're with you, Nick. But you know, the governor has this thing, and we don't want to make him mad. But CNA immediately supported this small movement from the beginning, not because it was politically popular, not because it would win them friends in Springfield, but because they represent nurses who recognize that supporting single payer is the right thing to do for their patients. They've never wavered from this commitment to patients or to social justice, and have stood up for the marginalized in the best traditions of organized labor, certainly, in the best traditions of medicine, certainly, and in the best traditions of social progress. No country in this world has achieved universal health care without the support of organized labor, and the California nurses really lead in a way that no other union does. I also want to acknowledge the now departed Dennis Kucinich. Single payer probably has no more forceful or articulate advocate in the Congress That's why those of us in the movement refer to H.R. 676 as the Conyers-Kucinich bill. So it's fitting that this historic accomplishment, and it really is historic, the first victorious single-payer vote in the Congress came under his direction. But let's be clear, and this is something that almost everyone in this room I'm sure knows, and for the staff that's present, the inclusion of the Kucinich Amendment doesn't remedy the substantive defects of H.R. 3200. The legislation will fail to provide universal coverage and to control costs, and we'll soon be back at the healthcare drawing board. But the Kucinich Amendment does enhance the bill in two ways. First, the Kucinich Amendment makes 3200 more politically feasible, because those members who support single-payer, and there are 85 of them and growing as we know, are more likely to feel comfortable voting for a bill that includes a state single-payer option. And second, if 3200 should pass, it will fail, and the Kucinich Amendment provides a clear path to picking up the pieces and building a workable single-payer model in its place. Members should continue to support single-payer H.R. 676 before anything else, of course, but if H.R. 3200 is to pass, it's critical that the Kucinich Amendment be included. I encourage the members and the staff in the room to press hard for its retention. Thank you so much.